Autism Screening with Dr. O'Brien, a pediatric developmental pediatrician who has over 25 years' experience working with autism.
Autism is a devastating disorder that impacts a child's ability to communicate and relate socially in varying degrees. It is often accompanied by bizarre and repetitive behaviors with extreme aversion to change. Autism places an enormous strain on families, and parents are at an increased risk for divorce. Today, with the incidence of autism reported to be as high as 1 in 166 children, the American Academy of Pediatrics recommends that physicians routinely screen for autism.
The next 2 to 3 minutes of this video demonstrate the CHAT, Checklist for Autism in Toddlers, a validated screening tool that helps flag those children most severely at risk for autism. It can be administered quickly and easily in a busy primary care setting. Screening becomes extremely important given the time constraints in the often hectic environment of a busy pediatrician's office. Since the cause of autism remains as yet unknown and no routine biological markers exist at this time, diagnosis relies entirely on the parent's history and the physician's observation of the child. To complicate matters further, we as physicians are primarily trained to look for sickness and often do so instinctively. Children with autism rarely look ill. In fact, they may look perfectly normal and may even have attained all their pediatric milestones. Sometimes the child may present as though he is just lacking firm parental controls. The parents of this child, both medical professionals, suspected that something was not quite right with their son from the time of his birth, yet they were still completely stunned when he was diagnosed with autism at age 2. The CHAT screening tool was developed by Dr. Simon Baron-Cohen, director of the Autism Research Center at Cambridge University in England. By working interactively with the child, the physician ascertains: does the child point? Does the child look when you point? Does the child pretend play? Children at 18 months should already be engaging in pointing and pretend play. Firstly, the physician will attempt to determine if the child points by asking a simple question such as,
"Can you show me where the lights are?"
The child should respond by pointing with the index finger and should also look at the physician's face around the time of pointing. Secondly, the physician will determine if the child can follow a point. The physician gets the child's attention and points across the room at an interesting object, for example, a teddy toy, and says,
"Oh, look, there's the teddy."
The physician watches the child's face and observes if the child looks across the room to see what the physician is looking and pointing at, as opposed to just looking at the physician's hand. Thirdly, the physician determines if the child engages in pretend play, using examples such as,
"Can you pour some tea in the cup?"
Another example would be,
"Can you call me on the phone?"
The child should be able to pick up the cell phone and hold it to his or her ear. The physician may choose to use other objects to elicit these responses. It should be noted that the CHAT is a screening tool and not a diagnostic instrument. Any child that is identified will require further evaluation, referral to early intervention services, and potential referral to appropriate specialist as determined by the physician.
I cannot stress how vitally important it is to identify children at risk as early as possible. Routine screening is the key to that. Not only can it greatly improve the outcome for the child and his or her family, but routine screening can also avert the unwelcome problems associated with delayed diagnosis.
Remember these 3 simple points. Does the child point? Does the child look when you point? Does the child pretend play?
This video has highlighted the most important aspects of the CHAT screening tool. The complete one-page screening tool is available on this disc for printing.